So for many years, I've had a working relationship with the Levine Children's Hospital. I've hosted telethons that raise money for the organization. I've been to the hospital on many occasions to interview moms and dads and young patients and doctors. Many of them have been guests, invited guests here on Charlotte Today during my 9 years hosting the show. And now I have a very personal relationship with the Levine Children's Hospital. My son was involved in a rugby accident in June. He was playing in a tournament in Rock Hill. He made a tackle. It was a very routine tackle, and he took a knee to the left side of his head. It fractured his skull, and then it caused a brain bleed. He was airlifted from CMC Pineville to Levine Children's Hospital, where doctors performed emergency surgery to save his life. This morning, we welcome Dr. Scott Waite, the medical director of pediatric neurosurgery at Levine Children's Hospital, and my beautiful son, my walking miracle, Anthony Archdeacon. Hi.
Yes.
Dr. Waite, thank you for being here. Honey, thanks for coming to the show today to talk about this. Okay, first off, Anthony, I have to tell you, everywhere I go, people are always asking me, how's your son doing? How's your son doing? So this is an opportunity for you to tell people yourself, how are you doing?
Yeah, no, I'm doing all right. Physically, I'm fine. I just have a scar, but...
That's why you wear a hat all the time.
Yes, exactly. I've been wearing this hat ever since. But yeah, I've been doing all right. But then, it's just tough not being able to play. I got my first football game tomorrow, but I won't be able to play in that. That's tough.
The Ardwick-Kell varsity team. Yeah. I know that's hard for you. So emotionally, it's been more difficult.
But physically, I'm fine. I'm working out. So, yeah.
So what do you remember about the whole accident?
Yeah, so I don't really remember the play, but I'm pretty sure I took the knee to the head. And then I don't remember any of the day I got surgery, which I think was Sunday. And all I remember was just waking up on Monday in the bed.
Dr. Waite, how critical was Anthony's injury by the time that he got to you?
Yeah, usually we like to see our patients and examine them before we make the decision for surgery, but Anthony had a CT scan at CMC Pineville, and we heard about this scan and were able to look at it while he was on the way. And this was one of those situations where we don't need to see anybody. It's just time to get an operating room ready. And that's exactly what the team did. He went straight to the operating room. So he was sick. He needed an operation. He needed it quickly.
Thank God. And again, you're happy with his prognosis. I mean, he has no, people ask me that. Does he have brain damage? He does not have any brain damage. He's physically doing quite well.
I'm thrilled with the outcome he's had, and I expect him to lead a perfectly normal, perfectly healthy life.
I know you're very proud of the strength of the neurosurgery program here in Charlotte at Levine Children's Hospital.
It's a great collaboration amongst a lot of people. I'm a partner in Carolina Neurosurgery and Spine Associates. We work closely with Levine Children's Hospital to provide the care for patients like Anthony and other patients that come in every day with similar stories.
I need to brag on Dr. Waite for just a minute. He's one of the top 5 in the country. And, I know most of you won't pick up the phone and call and make an appointment with him. God forbid, I didn't ever think we'd have that situation, but thank God that you're here, and we are forever grateful to you. Isn't that right, son? You sit by Dr. Waite, who saved your life.
Yeah.
It's amazing.
You said there was a team of doctors. You saw the scans. It was a team. What's your team comprised of? Do you have different sections of what you do when you're dealing with a child?
Yeah, great question, and that's an important point for this great story, and that is that this is not a surgery or an event that occurs in isolation with one person. There's a whole OR team that's responsible for getting his care. We have residents. The resident that's most responsible for you doing well is a fellow named Dr. Vincent Rossi. He immediately saw your scan, immediately recognized what needed to be done, and basically I need to give him the okay to make it happen. And so that team deserves a lot of credit. It goes all the way to the recovery room nurses, the PICU doctors, and so it's just great to be part of a team where we know we can handle things like this that come in and have great outcome.
Anthony, honey, what do you remember, when you were in the hospital, in the ICU, what do you remember about the care you received from the nurses and Dr. Rossi and Dr. Waite?
There's just always someone there when I needed them, Every time I wake up, always be sleeping. If I needed food, I ate a lot of Jell-O. Someone always gave that to me. So, yeah, it was very nice.
Yeah, they were great, weren't they?
Yeah, they were.
Everybody was so loving and so helpful, and that was wonderful. Accidents obviously cannot always be prevented. But Dr. Waite, what is it that you would like families or parents who are watching right now to know about sports-related injuries or precautions that they can take or things that they should be on the lookout for?
Sure. Well, you know, in the course of our daily lives, especially if we play sports or ride bikes on a road or whatever, head injuries happen. If we ride on the highway, these happen. But the days of saying, oh, I've had a dinger or something like that and just ignoring it and getting over it, those days are long gone. So we know that concussions are a big deal and they need to be taken seriously. People need to be evaluated by a medical professional if they have something like that. So.
My question is for Anthony. How have your family and how have your friends helped you in your recovery?
Well, my family, they've been, every time I'm feeling like I need to cry or if I need to be with them, they're always with me. And then my friends, you know, they make me feel normal, you know. Like we talk about it a little bit, but, you know, we won't bring it up too much and they'll just usually stray away from it. But if I need to talk to them about it, they'll help me with that.
We just took a picture of Eugene visiting you, and right there, those are the Ardwick-Kell rugby, part of the rugby family. Mama Busby, Susan Busby, and Coach Mack, and Coach John Downey, and the Ardwick-Kell, shout out to the Ardwick-Kell rugby family, and Ardwick-Kell football team, including Coach Kyle Bray, who've offered you coaching positions on the team, and how do you feel about that?
That's awesome. Just to stay around the games I love, it's really, I like that.
I know this has been traumatic, but let me just encourage you in this. You will get through this, even though it's difficult, you'll get through. And I'll also say this, give yourself time and grace to go ahead and go through all the different emotions. That's just a proper normal process, and that's not something that's odd. And cry when you need to cry. That's what I'm gonna tell you. I'll cry with you, my brother.
Right.
I love you.
He does. We cry all the time, but I think it's part of the healing process.
Indeed.
Part of it for you and for your family. So thank you. That wasn't so bad, right?
Yeah.
Thanks for. He's like, no, this is all right.
And thanks to Levine.
Oh my gosh.
Thanks to Levine. I know because you do Levine's thing all the time, and now you're sitting in this chair right here. Thank you, Levine, for all the stuff that you do for all the families.
You were wonderful, and I'm grateful forever. I told Dr. Wade I wanted to get him like a gift card or something to say thank you, but then that felt not enough. So this is the thank you.
Yes.
This is the thank you. But we are very grateful.
Good to see you doing well.
Yeah. All right. Hey, honey, now go clean your room, okay?
Okay.
All right. Brush your teeth and floss.
Well, coming up this